Okay, so this is chapter 15, day 9, and this is finishing up the chapter for chapter 15. So this is the last recording, actually. Uh, the previous recording, we talked about uh, the autoclave, and we talked about chemical disinfection. Today, we are going to talk about ultrasonic unit, and they are used mainly in dental and medical offices. Oh, I'm sorry, let me get to the other screen so it looks nicer. Okay, there we go. And other health agencies remove dirt, debris, blood, and saliva and tissue from a large variety of instruments before sterilizing them. So the ultrasonic units do not sterilize them. It's something instruments may go into the ultrasonic unit before being sterilized. When the ultrasonic unit is turned on, the sound waves produce millions of microscopic bubbles in a cleaning solution. When the bubbles strike the items being cleaned, they explode, a process known as cavitation, and they drive the cleaning solution onto the article. And so just think of the instruments being in some water, and there's going to be lots and lots and lots of bubbles, and the bubbles are bombarding the instruments, and as they bombard them, they clean them, and they get off anything else that's on there. Any accumulated dirt and residue are easily and gently removed from the article in the ultrasonic unit. Here is a video on the ultrasound unit and how it works. So be sure to go back to the Google Classroom and look up for Chapter 15, Day 9, and watch that video there. Let me pass it. So again, the ultrasonic unit does not sterilize because spores and viruses will remain on the articles even after going into the ultrasonic unit. So it's something that they can, the instruments can go into the ultrasonic unit before being sterilized. If sterilization is desired, other methods must be used after the ultrasonic cleaning. And we talked about one of those methods in the previous recording, which would be the autoclave. Many different items can be cleaned in an ultrasonic unit, including instruments, dental impression trays, glass products, and most jewelry. And just like you had to do with the autoclave, you have to clean the instruments and get out most of any dirt or particles are on there before putting them into the ultrasonic unit. And like everything else, you must read the instructions. 15.7 workbook pages are not required to be turned in, but of course, if you want, you can work on those, turn them in, and I will look over them to make sure your answers are correct so you can use it to study for the test. So, sterile techniques. It protects the patient from further infection. Surgical asepsis refers to procedures that keep an object or area free from living organisms. So, a surgical asepsis technique keeps everything free from all living organisms. Sterile means free from all living organisms, and contaminated means that organisms and pathogens are present. So you want to remember pathogens cause disease. When using sterile techniques, it's important that the correct techniques are being followed to maintain sterility and avoid contamination. And this is the picture there is what a sterile lab might look like. And of course, the sterile object must never touch a non-sterile object. If it does, then the sterile object becomes contaminated and it'll have to be sterilized a second time. Sterile objects must also be held away from and in front of the body and above the waist. So if you've ever watched a doctor show or Grey's Anatomy, the doctors always have their hands up after they wash their hands, and that's why, because everything below the waist is considered to be contaminated. The sterile field. Once the sterile field has been set up, you never reach across the top of the field. So think about why that might be. And one reason is as you reach across, you might have microorganisms that fall from your sleeve onto the area, so which would again make it contaminated. You never turn your back on a sterile field. You want to avoid coughing, sneezing, or talking because of airborne particles. Even if you have a mask on, you still want to try to avoid that. Also, a 2-inch border around the sterile field is considered contaminated. So the 2-inch borders around the sterile field is considered contaminated, and so you just want to remember that when placing sterile objects down. Of course, you want to check sterile items, make sure they're checked carefully before they are used, and if the item was autoclaved and dated, most facilities use items within the first 30 days. If it's past 30 days, then they would go into the autoclave again. If there's any tears or stains on the package, the item should not be used because it is considered to be contaminated. If there are any signs of moisture on the package, it has been contaminated and should not be used. Again, anything that is wet, pathogens can easily go through them, and so you can't have anything to be wet, and the sterile field must be kept dry. You want to make sure that the sterile tray is open and you are ready to do the sterile procedure before putting on the sterile gloves. Thus, the last thing you're going to do is put on the sterile gloves. Once on, of course, it's important to hold your hands away from the body and above the waist to avoid any contamination to the gloves, and only handle sterile objects while wearing your sterile gloves, because again, if you touch anything that is not sterile, your gloves are considered contaminated and you will have to put on new sterile gloves. If at any time during a procedure there is any suspicion that you have contaminated any article, you need to start over. Never take the chance of using contaminated equipment or supplies. And there's an example in the picture of some sterile objects. And workbook 15.8 is not required for you to do. So maintaining transmission-based isolation precautions. Communicable diseases, they oftentimes require isolation. So the patient is put into their own room. And communicable diseases are caused by pathogenic organisms that can be easily transmitted to others. So again, that's why they're put in an isolated room so that they don't spread it to a roommate. Epidemic, it spreads rapidly from person to person and affects a large number, whereas a pandemic, the outbreak occurs over a wide geographic area and affects a high proportion of the population. So we are in a pandemic right now because the COVID-19 is worldwide. For transmission-based precautions is a method or technique of caring for patients who have communicable diseases. So it's the transmission-based precautions is that technique that is used to care for them. An example would be tuberculosis, wound infection, pertussis, which is whooping cough. And they are used in addition to standard precautions. So remember, you always use standard precautions in all situations. So the transmission-based precautions are used in addition to the standard precautions. They take that extra step and that extra safety precaution. Transmission-based precautions provide that extra protection to prevent the spread of disease or pathogens. How are communicable diseases spread? They are spread by direct contact with the patient, contact with dirty linen, equipment, and or supplies. They can, with contact with blood, body fluid, secretions, and excretions, such as urine, feces, droplets. You get droplets when you talk or you sneeze, and any discharges from wounds. So transmission-based precautions are used to limit contact with the pathogenic organisms. So it decreases the risk of spreading the pathogenic organisms. It helps to prevent the spread of the disease to other people and to protect patients, their families, and healthcare providers. So sometimes personal protective equipment is used to provide protection from the pathogens, such as gowns, gloves, face shields, and masks. It depends on which precautions are needed as to what is used. Sometimes only a mask is required. Contaminated or dirty is objects that contain disease-producing organisms. Objects should not be touched unless protected by gloves, gown, and other required items. So you're going to wear gloves or a gown if needed so that you're not touching the contaminated objects with your own skin. The outside and waist heights of the gowns, protective gloves, and masks are considered contaminated. So clean, the objects or parts of the objects do not contain disease-producing organisms, minimal chance to spread the disease. So every effort must be made to prevent contamination of these objects or parts of objects. This would be the inside of your gloves. The gowns are clean, as are the neckband, its ties, and the mask ties. So there's 4 main classifications of precautions, and we're going to talk about each one individually. There's the standard precautions, which we've talked about, and that's washing your hands, gloves, picking up spills quickly with sharps, using the right protocol for using sharps and putting them in sharps boxes. And again, you always use standard precautions. Always, always, always. Airborne precautions, droplet precautions, and contact precautions. So healthcare facilities are actually provided with a list of precautions needed for each specific disease. So if someone came into the hospital, they could look, oh, this patient has tuberculosis, and they would look to see what precautions are needed, and then they would make sure that all those precautions are taken. So in class time, this was a time when students could work on their 15.4 workbook pages and also reading section 15.9. And they were given a crossword puzzle. 15.9 is required to be turned in for a grade. So make sure you're working on that. Again, if you have any questions or concerns, feel free to give me a call. So like I said, there's 4 main classifications of precautions, standard precautions. And when do you follow standard precautions? You follow them all the time. Airborne precautions are used for patients known or suspected to be infected with pathogens transmitted by airborne droplet nuclei, which is actually small particles of evaporated droplets that contain microorganisms and remain suspended in the air on the dust particles. Examples of diseases include rubella, which is measles, chickenpox, tuberculosis, severe acute respiratory syndrome, which is the SARS. So if you think about somebody with tuberculosis and even SARS, let's say they cough, and right after they cough, you walk through that area to where they're cough, and you're going to breathe in that air, and therefore you could get tuberculosis or you could get SARS. So airborne precautions, it's transmitted by the droplet nuclei. So very small droplets, very small, the nuclei. In addition to standard precautions, because you always use standard precautions, the airborne infection, they should be in an airborne infection isolated room. The doors should always be kept closed, and the air in the room must be discharged to outdoor air or filtered before being circulated to other areas. Because it's in those small nuclei that's in the air, you can't let it be circulated into another part of the hospital because the people in that part of the hospital get sick. So it has to either go outside or it has to be filtered first. So again, you still use the standard precaution for airborne precautions, but you must wear respiratory protection. So the N95 is on the lower left. It's on my lower left, so hopefully it's on the lower side. Or the P100, which is up on the upper right, and it's a more powerful filtering mask, such as a high efficiency particulate air mask, which is a HEPA mask. So you can't just use a surgical mask, or you can't use the cloth ones that people are wearing, because those small nuclei would still get through those masks, and you could still get sick. So the respiratory protection must contain special filters to prevent the entrance of those small airborne pathogens. You also must be fit tested to make sure there's a tight seal. Men with a beard cannot wear a standard mask, but they can use a special HEPA filtered hood instead. Because again, why can't they wear one if they have a beard? They're not kind of a tight fit around their mouth. So I know a guy who works at Sparrow, and when COVID started, he shaved his beard for the first time that I've known him in order that he could have a better fitting mask. Also with airborne precautions, people who are susceptible to measles or chickenpox should not enter. So it may be somebody who hasn't had those vaccinations. It could be an adult who did not have chickenpox when they were younger and did not have the chickenpox vaccine. They should not enter into those rooms. And patients should stay in their room if possible or wear a surgical mask if they leave. So with airborne precautions, with any other transmission-based isolation precautions, they're going to limit who visits that patient. Most of the time, it's just going to be family, and just going to be family. So it could be spouses, it could be parents, it could be siblings, children. But they're not going to let just any, and by children I mean adult children. They're probably not going to let children in under 18. They're not going to just let their cousin 3 times removed come to visit them. It's going to have to be people who are really close to them. Here's a sign of what you may see on a patient's door, and also in the book there's an example of the signs as to make sure that everybody who goes in there has the correct mask on. So there's also droplet precautions, and they're used for patients infected with pathogens transmitted by large particle droplets expelled during coughing, sneezing, talking, or laughing. So with airborne, they're very, very small droplets, and with droplet precautions, they're the larger droplets. So this is for the meningitis, pneumonias, diphtheria, mycoplasma pneumonia, whooping cough, mumps, and severe viral influenza would be using droplet precautions. So of course you're going to use the standard precautions still, and they need a private room, and masks must be worn to enter. So that for the droplet precaution, a basic surgical mask would be okay to wear because the droplets are bigger. If a patient leaves the room, they must wear a surgical mask. And there's an example of a droplet mask. Or a droplet sign that would be on the door. So remember, airborne and droplet, you have to wear masks. The airborne, you have to have a HEPA mask, P100 or N95 mask. A droplet precaution, you could just wear a basic surgical mask. So that's the difference between the two. For contact precautions, for a patient with an epidemiological, which is capable of spreading rapidly from person to person, microorganisms that can be transmitted by either direct or indirect contact. So this could be an example of a gastrointestinal, respiratory, skin, or wound infections caused by multi-drug resistant organisms. Diapered or incontinent patients with enterohemorrhagic E. coli, hepatitis A. Any skin infections are highly contagious, so that may occur on dry skin, such as diphtheria, herpes, impetigo, body lice, scabies. So with contact precautions, if you touch their skin or if you're going to get near them, would be contact precautions. So again, in addition to standard precautions, they need private rooms, and gloves must be worn to enter a room for contact precautions. Gloves must be changed after having contact with any material that may contain high concentrations of the microorganisms, such as wound drainage or fecal material. So let's say if someone had scabies, it can be on their legs and it can be on their feet and in between their toes. So if I was going to put TED hose, which are compression stockings, on a patient, I would go down to their feet and put them on their feet. And in that time period of trying to get their TED hose on, I'm going to touch their feet. I'm going to touch their legs where there could be scabies. So after I'm done, I say, hey, their face needs to be washed. I would need to go change my gloves, wash my hands, put clean gloves on, and then go wash their face. So if I'm going to touch any area that may have a high concentration of those microorganisms, I need to make sure I change gloves before I do something else with that patient. Gloves must be removed prior to leaving the room and hands washed with an antimicrobial agent. So with these rooms, you're going to have right by the door probably trash, and you're going to remove your gloves and your gown before leaving the room. So in addition to gloves, you must wear a gown to enter the room, and again, that also has to be removed prior to leaving the room. You need to ensure that clothing is not contaminated after gown removal. So you have to be careful in removing the gown that your gown doesn't contaminate your clothes at that point. Movement and transport of the patient from the room should be for essential purposes only, and you need to have daily cleaning of the room and items and disinfection as needed, and patient care equipment should be left in the room if able. So a blood pressure cuff may be left in the room, stethoscopes may be left in the room, bedside commode chair. If someone needs a Hoyer lift, which is a lift that picks up the patient from their bed or chair or commode and moves them around, that would also get left in the room also. So contact precautions, you need gloves, you need gowns, and daily cleaning of the room and disinfection. So for contact precautions, you do not need to wear a mask. This is pre-COVID. So pre-COVID, for contact precautions, you do not need to wear a mask because it is not in the air. So you cannot breathe it in. You would just, in your process of touching the patient, is when you could get contaminated. So no mask is needed for contact precautions pre-COVID time. There's also the Ebola virus disease, or EBD precautions. The first outbreak to reach the epidemic proportions occurred in West Africa in 2014. So as a result of this, the CDC formulated more stringent infection control guidelines to be used in order to contain this so it didn't continue to spread. They had strict enforcement of not only the standard precautions, but also contact and droplet precautions. The patient is to be placed in an airborne infection isolation room, which is the same type of room an airborne precautions patient would need, with restricted visitation. Again, medical equipment would be dedicated to that patient only, and the use of needles and blood draws are limited to necessity only. Also with the EBD precautions, PPE is a high priority. They had intense and repeated training must be done to ensure that the correct PPE is used and that is put on, which is donned, and taken off, which is doffed properly. So they really trained healthcare workers on how to put their PPE on and how to take it off properly. And sometimes they would even require a second trained staff member to supervise the donning and doffing of PPE at all times, and that's just a second person to check to make sure that PPE was put on correctly. It must cover all skin, head, neck, body, and their feet. And they use a power air purifying respirator, or an N95 must be worn at all times, which is that mask. Sometimes they also encourage double gloves, not sometimes. They encourage and want double gloves to be worn, and that's just 2 pairs of gloves on one hand, and it's just that extra protection. Diligent hygiene is essential, so hand washing. And a separate room or area should be designated for donning and doffing of PPE. All precautions need to be followed by anyone providing care to an infected or suspected patient who has EBD. So there's also protective and reverse isolation, and this is methods used to protect certain patients from organisms present in the environment. So for airborne, standard, airborne, droplet, and contact precautions, it's to prevent other people from getting sick from the patient. So protective or reverse isolation is preventing the patient from getting sick. Okay? So these were the people that before COVID, if you went into Walmart pre-COVID, when not everybody had to wear a mask, you might see someone wearing a mask and think, why are they wearing a mask? And it was because they did not want to get sick. So this is used for patients who are immunocompromised, which means that their immune system is not up to par and not up to working at 100%, and they could get sick very easily. So examples of patients are transplant patients, the patients who have had a recent transplant, or someone who is waiting to have a transplant, severely burned patients, and those who are receiving chemo and radiation. So these people are likely to get sick very, very easily. So in addition to standard precautions, of course, the room needs to be cleaned and disinfected, and frequent disinfection of the room is needed. And also those who enter need to wear clean or sterile gloves, gowns, and a mask. And it's again so that pathogens are on your uniform or on the clothing that you're wearing. Do not get on the patient so the patient does not get sick. All equipment brought in the room needs to be disinfected or sterile. Special filters may be used to purify the air that enters the room. And every effort is made to protect the patient from microorganisms that cause infection or disease. So if I'm a nurse and I'm working with other patients, I'm not always wearing a gown. So as I'm touching patients, I'm going to get pathogens on my uniform. And then if I go into a patient who is receiving chemo or radiation, and they're immunocompromised, if I don't have a gown on, then some of those pathogens that are on my uniform could get on them and cause them to get sick. So in this case, you're not wearing a gown to protect yourself and your other patients from getting sick. You're wearing a gown and gloves to protect that patient from getting sick. So again, protective reverse isolation is to prevent that patient from getting sick. So exact procedures for maintaining transmission-based isolation and precautions vary from one facility or another, and basic principles are all the same. So remember, standard precautions you use at all times. So there was the closing work. So if you have any questions, be sure to let me know. You can email me, you can call me, contact me in any way if you have questions. And for chapter 15, day 10, I do believe, it does go through the process of how to put a gown on and gloves and all of that stuff. So you can go ahead and read through that. But this finishes up chapter 15. So thank you very much.